I think it's important for researchers and clinicians to work together to manage obesity because of its complexity. We have a medical clinic here, but a big part of our treatment has to do with the surgery for morbid obesity. Obesity is now recognized as a chronic disease. It's very complex. We bring in as many individuals as possible to meet with the patient and help the patient. It's a very heterogeneous group of patients, and they all have different aspects and different disease profiles. I think we're trying to do our best to understand that. Research is essential because we're continuing to learn more about obesity, and we try to follow the research that's happening in the world and bring any of the important findings into our clinic. In terms of surgical approach for morbid obesity, there are a couple of options that we tend to talk about here in the clinic. We do two operations. We offer two operations: the laparoscopic adjustable gastric band and the laparoscopic gastric bypass. Both operations are good operations, very safe, and they provide excellent outcomes for patients who are obese or morbidly obese. The adjustable gastric band and the gastric bypass are quite different in terms of the surgical procedures and their complexity, and they also have some difference in their outcomes, their long-term outcomes. I think some of the future directions in surgery are to continue to improve the procedures, to make them safer and to improve on their outcomes. Certainly what we try to do in this clinic is we try to prepare patients appropriately for the surgery. We think it really needs a dramatic lifestyle change in order for patients to see optimal outcomes, and that's a big part of what we do. Most of our patients will spend a year in the clinic getting ready for surgery. When we think that they're ready, then we'll proceed and we discuss with the patient the two management options that we currently consider. Ultimately, I think we'd like to look at surgical procedures that provide even a greater degree of safety, and people are now looking at exciting things such as using robotics for surgical management of obesity because of the technical challenges associated with the procedure, but then also looking at endoluminal forms of management. So in other words, purely endoscopic. So pure endoscopic procedures where we don't come through the patient's abdomen. We typically would go down through the esophagus into the stomach and consider management options there.